to get that out in the community. I think in other areas where the demand is outstripping supply, particularly for high-risk patients, I think, clinicians, and we've encouraged clinicians in our communications to consider the clinical evidence for other medications that people can take at home. So, for example, there's high quality data on inhaled budesonide that's reductions in hospitalizations. And fluvoxamine is another medication. There have been two randomized clinical trials that have been published in very good journals that have shown a benefit up to a 90% reduction in hospitalizations and death among people who were adherent to treatment in the fluvoxamine trial. Really great results. You don't hear about it because it's, Pfizer doesn't own it, Merck doesn't own it. There's no one to share that amazing news with people. But really great results and options for clinicians, particularly when there's a crunch on monoclonal antibodies and you're in the middle of a surge and you have a high-risk patient. And then, as the governor mentioned, we're working on testing. So my department's goal is going to be to put out testing that doesn't restrict access to testing, but reduces the use of low-value testing and prioritizes high-value testing. And what do we mean by that? So high-value testing is testing that's likely to change outcomes, right? So, if your grandmother gets a test, that's a much more valuable test than the 8-year-old, third graders that Los Angeles County is sending in to get weekly testing, right? The first one's is much more likely to change outcomes. So we're going to be putting out guidance that puts more emphasis on that. And we're going to be working to unwind the sort of testing psychology that our federal leadership has managed to, unfortunately, get most of the country in over the last 2 years. We need to unwind this testing planning and living one's life around testing. Without it, we're going to be sort of stuck in the same cycle. So, it's really time for people to be living, to make the decisions they want regarding vaccination, to enjoy the fact that many people have natural immunity, and to unwind this, this preoccupation with only COVID as determining the boundaries and constraints and possibilities of life. And we're going to start that in Florida. Okay, thanks.
Oh, yeah, talk about how initially there was. Can you explain why it was that they said the Regeneron may not work? Like, was that a clinical trial, or what was that in terms of Omicron?
Oh, sure. Yeah, absolutely. So what it was sort of a terrible clinical decision, and I think it actually highlights the fact that that the leadership of HHS doesn't have a clinical background. I think that's actually what that decision reflects. So the laboratory evidence was indicating that the affinity of the antibodies, such as the Regeneron antibodies, for the Omicron variant were diminished. And, so it seems that it's likely to not have the same effectiveness as it did previously. But that's not the same thing as concluding that the Regeneron antibodies, monoclonal antibodies, will not work in a patient with Omicron. So there's a difference between laboratory data and clinical data. And they made the decision to withhold the medication based on laboratory data, but we care about clinical outcomes, and the decision should be based, obviously, on clinical data, which is why they've reversed it.
The 20.
Well, good morning, and thanks, Broward Health, for hosting us here today. It's great to be back. Joined with the Surgeon General of Florida, Dr. Joe Ladapo. We also have Kevin Guthrie, our Division of Emergency Management Head, Secretary Simone Marsteller for the Agency of Healthcare Administration. Of course, we have the CEO here, Shane Strum. We also have Dr. Joshua Lenchis, who's the Regional Chief Medical Officer for Broward Health. We have Representatives Lamarca, Fabricio, and Barrero. Mayor Mike Udine from Broward County. I want to thank him for being here as well. Last week, I think many of you Many of you know we were concerned about what was happening with taking back of the supply, even more so than has been, of monoclonal antibodies. The federal government had stopped sending. Last week, I think many of you know we were concerned about what was happening with taking back of the supply, even more so than has been, of monoclonal antibodies. The federal government had stopped sending both Regeneron and Omicron to be able to do it. And so we, under Dr. Latipo's leadership, we push back against that. We feel there's no need for it to just be sitting on the shelves. We asked them to stop preventing the distribution of these treatments. And fortunately, we had done a deal with GlaxoSmithKline on the Sotrovimab, which a lot of people think.
Fuck, I hate you.
Last week, I think many of you know we were concerned about what was happening with
This is some bullshit. Like, some real bullshit here. Funds to increase, but recently, yeah. Okay, wait. Yeah, I like what you're selling, bro.
Joining us now is Dr. Jonathan Reiner. He's a CNN medical analyst and a professor of medicine and surgery at George Washington University. Dr. Reiner, Happy New Year. Thanks so much for being with us. Right now, we see millions of Americans ringing in the new year last night there. While cases are at a record high, what are you worried about now in the weeks ahead?
Well, I'm worried about our hospitals. We're going to continue to see millions and millions of cases in the United States. And even with a lower virulence, apparently for this variant, still about 2% of folks who contract the virus need to be hospitalized. And it's going to be a race. It's going to be a race between waiting for this surge to crest and hoping that we don't run out of hospital capacity. And again, it's not just the bed capacity in the hospital. What we're really worried about is hospital staff getting ill and having to isolate. And it's going to be close in many parts of the country. We're seeing hospitalizations in places like New York rise significantly. You know, where I live and work in DC, also we're seeing hospitalizations rise. You know, we still have some capacity, but it's all going to depend on when this surge crests. And for parts of the United States that are less well vaccinated than New York and DC and the Northeast, they're in for more trouble, and this is coming to their communities very soon.
Well, a new study has found that immunity does wane against the Omicron variant with both Moderna and Pfizer vaccines.
Fire COVID.
All for that.
Well, there's a lot of politics involved, and they're walking this tightrope between trying to do what's right for public health and perhaps they're worried about undermining folks' confidence in the vaccine.
Oh, sorry, their pocketbook. Because that's what we call them now. I was not informed, so in case nobody knows. They are no longer wallets, they are pocketbooks. Or, again, they're pocketbooks, because that's an old. PBS. I like that they're trying to take. Streamed 2 weeks ago. I am Oh, I like you.
I just want to say something quickly. You know, Joe Biden has taken to himself to try to single out Florida over COVID. This is a guy who ran for president saying he was going to, quote, shut down the virus. And what has he done? He's imported more virus from around the world by having a wide open southern border. You have hundreds of thousands of people pouring across every month. And it's not just from Mexico. In fact, it's rarely from Mexico. You have over 100 different countries where people are pouring through. Not only are they letting them through, They're then farming them out all across our communities, across this country, putting them on planes, putting them on buses. Do you think they're being worried about COVID for that? Of course not. So he's facilitating. Who knows what new variants are out there? But I can tell you, whatever variants are around the world, they're coming across that southern border. And so he's not shutting down the virus. He's helping to facilitate it in our country. And what is his big solution? What is he so upset about Florida? His solution is he wants to have the government force kindergartners to wear masks in school. He doesn't believe the parents should have a say in that. He thinks that should be a decision for the government. Well, I can tell you in Florida, the parents are going to be the ones in charge of that decision. And one of the major medical people in his administration just recently told parents that they should be wearing masks at home when they're around their own children. This is insane. Joe Biden also believes that vaccination should be mandated by force of government and that you should have to show vaccination status to be able to participate in society. Now, Florida, we're very proud of our Seniors First strategy. You look at the mortality in nursing homes among seniors declined dramatically. But we said from the beginning, we're going to make it available for all, but we're not going to mandate it on anybody. That's ultimately an individual's choice to be able to do it. Biden, he rejects science because he denies the fact that people that recover from COVID have long-lasting immunity. And that's been proven time and time again, and the data is very clear. So his vision is, just like in New York City, restaurants should ban young kids from being able to go in because they're not eligible for vaccination, and law-abiding citizens have to produce proof of their medical records just to go to the gym or attend an event or just to participate in everyday society. He wants that, but yet if you want to vote, he thinks it's too much of a burden to show a picture ID when you're voting. So no voter ID, but have to show your medical papers just to be able to live an everyday life? Give me a break. And so I think the question is we can either have a free society or we can have a biomedical security state. And I can tell you, Florida, we're a free state. People are going to be free to choose to make their own decisions about themselves, about their families, about their kids' education, and about putting food on the table. And Joe Biden suggests that if you don't do lockdown policies, then you should, quote, get out of the way. But let me tell you this. If you're coming after the rights of parents in Florida, I'm standing in your way. I'm not going to let you get away with it. If you're trying to deny kids a proper in-person education, I'm going to stand in your way, and I'm going to stand up for the kids in Florida. If you're trying to restrict people, impose mandates, if you're trying to ruin their jobs and their livelihoods and their small business, if you are trying to lock people down, I am standing in your way, and I'm standing for the people of Florida. So why don't you do your job? Why don't you get this border secure? And until you do that, I don't want to hear a blip about COVID from you. Thank you.
Chose branding because of the thing that goes around on certain websites. Is this why you came to branding because of the controlling of the Biden administration?
So I think that Brandon, Florida is a great American city. I can tell you, my only negative on Brandon was when I was growing up playing baseball, they always used to beat us every year. But now I think, as governor, I'm really proud to. I just want to say something quickly. Joe Biden has taken to himself to try to single out Florida over COVID. This is a guy who ran for president saying he was going to, quote, shut down the virus. And what has he done? He's imported more virus from around the world by having a wide open southern border. You have hundreds of thousands across that southern border. And so he's not shutting down the...
Google. Thanks. That's what I wanted.
I just want to say something.
I'll stand here all day. I don't give a shit.
Last week, I think many of you know, we were concerned about what was happening with taking back of the supply.
Mm-hmm. Oh, Jesus.
Okay, with that, yes, sir.
And second, what do you make of this hysteria regarding your so-called vacation last week with the MIA?
Yeah, I mean, I guess I should have been at the beach in Delaware, right? And then they would have been really happy with that. You look, we actually put out the schedule, and I think these people didn't know that. They think because you're not doing a big press conference, you're not doing. So, Friday we were, Kevin, Joe, and I all had discussions about, doing what we're doing. Of course, I was at the, down in Miami later, Thursday in the office working on this and some other stuff. It is true, Wednesday, there was nothing on the calendar. And so I think they're like, oh my God, he's on vacation. And I'm like, and I just looked at my wife. I'm like, going to the hospital with you is not a vacation for you. I know that. And it's not a vacation. I mean, this is something that as a husband, I think that I should be doing. I've accompanied her to all her chemotherapy treatments, and she's there for a long time. I mean, I'm there most of the time, but it's a draining thing when she's done with it. It's not something that's great to see. And so I just think a lot of people, particularly people that have gone through breast cancer treatments, the notion that would be considered a vacation, I think is offensive to a lot of those folks, and they understand, what you're doing. At the same time, she's committed to not being in the fetal position the whole time. And, she's not through with it, but she's almost through with it. And I think she's going to end up good on the other end of it. But that's just, the way she is. And so, yeah, I think it was dumb. There was a foot fault, obviously, on their part. It wasn't effective. And all I can tell you is that, sometimes, we just try to get this stuff done. I mean, I don't care. I mean, we don't do political. We just want to help people with this. But, when you're in a political arena, sometimes you're fortunate in the enemies that you have because, these are folks that are just not shooting straight right now.
You look really good when they fucking ask questions that are none of their business. And you end up being able to answer them with, oh, I was going to my fucking wife's chemo treatment therapies.
My predecessor. Oh, God, I miss it.
Yeah, but we love hearing people with a lot of responsibility talking shit like girls in fucking high school as if they're like 16 years old in a fucking Bad Girls Club. Where's your food?
With that, yes, sir.
Are you gonna actually eat? Go eat your food? Go eat your food? Go eat your food? Go, 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 go. Not eating your food? Grab it. Why are you giving me shit already? Because I'm too retarded, obviously. Just gonna fuck it all up. How you focus on your job of being a nurse and not so much pranking and crisis actor and all this drama bullshit. Yeah, I know. Here. Boom.
Florida's Republican governor wants to find new ways to cause problems for Florida businesses, including massive fines. Republicans like to call business regulation socialism unless Republicans are doing it. Florida's Republican governor has called the Republican legislature back into session to have them vote on new ways to punish Florida businesses that require their employees to be vaccinated. Governor Ron DeSantis wants to fine businesses $50,000 if an employee is not offered 5 different ways to opt out of being vaccinated. One of the ways the new law the governor is proposing would allow a worker to opt out of being vaccinated is by wearing a mask. So the governor, who is opposed to masks, is now saying employees must wear masks if they are opposed to vaccination. The proposed Florida laws are in conflict with federal regulations now, and
Mo, get the fuck out.
before we start the video, I just want to let you guys know that we launched a Let's Go Brandon t-shirt on the merch shop. So go ahead and click the link down below in the description. It's a great way to support us here at the Liberal Hive Mind. Let's go, Brandon. I agree. Hey guys, welcome to the Liberal Hive Mind, a channel solely focused on exposing the abundant hypocrisy of the left. Why is it always the Democrats? Once again, I'm asking you both sides type.
How about? Oh, cool. Something about where I actually live.
Toronto school students were provided with rapid antigen tests over the holidays and were asked to test themselves every 3 to 4 days. But the test results aren't being collected by authorities on a mass scale, which one group says is a missed opportunity to provide vital information to the public.
The fact that we just have this black hole out there in terms of what the infection rates are. I think it's concerning.
Online magazine The Local has launched a rapid antigen test tracker where parents with children in Toronto's 800 public schools can anonymously submit test results from the kits they were given. Tests conducted anytime over the winter break are acceptable. The idea is to provide information about infection rates in schools so people can make an informed decision for their families.
They can have a better understanding of the situation. I think a lot of people are anxious. Parents are anxious. Students are anxious. Education workers are anxious. So knowing is better than not knowing, especially with kids. I think in Toronto, most school kids 5 to 11 there's only about 40% vaccination right now. But among those who are fully vaccinated, there's only about 4%. So they're walking into a situation where I think they want to know what infection, risks schools pose.
Tai explains that the province's lab PCR testing system maxes out at about 80,000 tests per day. 11 million rapid test kits were handed out to Ontario students before the holiday break.
On a per basis, on a holiday break, it makes the rapid antigen test system about 10 times the size of the PCR system, and yet we have no information coming back. So it's a real shame that we don't have that. And so, the more citizens, can voluntarily submit this data, the more info that we'll have to make those decisions, whether they're personal decisions or policy decisions.
Since the launch on Jan 1st, the rapid antigen test tracker has received about 2,000 submissions. The goal is to get at least 10,000.
The larger the number, the more we can break down the numbers, hopefully by school. I mean, that would be ideal to know per school. If we don't have as high a number, then we can do it by region, like a postal code area around the school, or at a minimum, we'll have an understanding of what the infections are in the city at that level.
Now, Tai says that this kind of effort can only last so long as students have rapid antigen tests, and they will likely run out of the 5-pack they were given very soon. As such, the group hopes to publish its findings by next week. For more on this story, you can go to our website, citynews.ca. For City News, I'm Dilshad Berman. The Indonesian coal export ban is causing fuel prices to rise across the world, a move that could soon disrupt energy requirements for some of the largest economies in the world. Meanwhile, coal miners in the country are seeking a quick resolution.
Mama, come. Post arrest. Okay. Yes. But why? It just clicked it. Like.
Miranda July is called before Congress to explain exactly what her whole thing is. A poll finds that Americans would be open to a third type of screwdriver head, and a new social media startup claims to be a cross between Facebook and Facebook. Dressed like that, you're practically begging for the week's news to be summarized for you. Come here, sweetheart. It's the Onion Week in Review. Executives from fast food giant Arby's announced Monday the launch of the restaurant chain's new grab-and-go value meal, which allows customers to go behind the counter at participating franchises and carry away as much loose roast beef as they can pick up with their bare hands. The already wildly popular $2.99 deal gives patrons 15 seconds to frantically scoop up fistfuls of hot roast beef from piled-high steam trays set out on the floor, with the only stipulations being that cargo pants are not allowed, and one shirt can be tucked into his or her pants with the intent of dropping roast beef down the collar.
A lot of pushing, a lot of clawing. Gotta watch these people steal the beef right out of your hands. As long as you hold your ground, it's an unbeatable deal. I mean, look at what beef I got.
Other fast food chains are beginning to follow suit, with Dairy Queen now charging customers $2.50 to drink from the soft serve nozzle until they need to take a breath, and Krispy Kreme expected to announce a 75-cent menu option that allows patrons to bring in any food item of their choosing and dunk it in the donut purveyor's signature glaze. According to a weird, completely unsolicited report issued by the Department of the Interior Wednesday, dry humping is an adequate sex alternative for teens. Baffled government sources said that the uncomfortably in-depth, incredibly well-researched 900-page document outlining the benefits of clothed genital stimulation over fully penetrative sex is all the more perplexing due to the subject matter falling far outside the department's purview of managing natural resources and administering programs for Native Americans. Despite its unsettling nature, some officials have acknowledged that elements of the report, specifically statistical models submitted by the U.S. Fish and Wildlife Service that measure the pleasure coefficients of various styles of dry humping, should be commended for its rigorous objectivity and may even be suitable for sex education curriculum. And in science news, this week the nation's gross doctors recommended drinking 8 cups of warm clam juice a day. The report issued by the CDC's Department of Gross Medicine specified that each serving of the room temperature clam extract should ideally have bits of shell floating in it and should be gargled in the back of one's throat for several seconds before being swallowed.
After your 4th cup of clam juice, we recommend eating whatever you find between your toes, or just mixing the toe jam right into your 5th cup. It's really great for you.
Gross doctors added that people with shellfish allergies can substitute a gallon of tofu runoff. In sports, David Stern Supernatural Investigation spinoff, NBA Nights. In other news, black conservatives throw their support behind a candidate whose religion believes black people bear the mark of Cain. The Supreme Court overturns right v. wrong, and a snake gets a tattoo of a dude on its face. We're through holding your hand this week. Time to return to muddling through life with no direction and few real prospects. For more, visit theonion.com/newsbeat.
No?
A cute couple is on the same antidepressant. KY introduces a new line of jam, and the world's youngest person is born. One day somebody ought to take a torch to this whole goddamn place, but for now, here is the Onion Week in Review. Thousands of outraged meth addicts urged the federal government this week to address the nation's growing spider epidemic. During a marathon 72-hour meeting under the Roosevelt Bridge Monday, tweakers from across the nation drafted a 45,000-word proposal to kill all the acid-shooting spiders before they develop the powers of mind control or, God forbid, flight.
We can't grow these spiders any longer. The government has to. You're gonna go. The spider there! The spider there! The spider there! It's too late!
While a gigantic, quote, spider bomb is not out of the question, the addicts have agreed that the best temporary solution would be for the government to issue them large quantities of methamphetamine and steel wool. In Ithaca, New York, a local daddy, Howard Lewis, was put in his bye-bye box Tuesday so that he could go on a long vacation with the birds and clouds in the sky. The daddy, who was once tall and strong and liked going to the hospital, was reportedly put in the bye-bye box after weeks of being sleepy all the time and